Good afternoon and welcome to Psy Interviews. We are back with one more expert personality in the field of mental health for this Psy Interviews. Welcome, sir.
Good afternoon and welcome everyone.
Thank you, sir. So I just take a couple of minutes to introduce Dr. Shishir Palsapuri, who is MD and MSc Psychology. He is not only a doctor, he is a catalyst for change, a speaker who electrifies the minds, a coach who ignites potential, and a therapist who unlocks the inner strength. So I was fortunate to train under Sir. It was way back 20 years. I was trained by him in St. Francis College for CBT, sir. I still remember those days and the training you gave 20 years back. So he trains thousands of people like me in CBT and REBT, leaving a lasting impact on individuals and professionals similar. So today we are very happy to have you, and few more things about Sir. He's an associate fellow and supervisor of Albert Ellis Institute, New York. He's an international life skill trainer and a psychotherapist. He's a director and founder of a company called Morphic Minds. And this is a training center which is affiliated with Albert Ellis Institute, New York. And Sir is a dynamic trainer, an international motivational speaker, life coach, therapist, medical doctor, and a corporate trainer. So he is really shaping the future generation of future of India with his unique program, which is Preventive Emotional Education Program by name CORE since 11 years. Very interesting to read Sir's profile. It's go on and on with few more pages. Definitely be listening to. We are very happy to have you, sir, today. And I am excited that being a student of you, I'm really practicing very religiously whatever you taught to me. So thank you, sir. And we'll start with the basic question to make people understand, is it a layperson or a counselor or a teacher or a therapist? What is REBT?
All right, so very good evening to everyone. I would like to add a few things to the introduction that you have mentioned. Thank you so much for such a kind introduction. So we have moved a little ahead from the introduction that we have said. It has been more than 13 years that we are running this emotional education program. And we are now affiliated to IAREBT, which is even a bigger association than Albert Ellis Institute. And now we are accredited to that institute. So answering your question, what is REBT, Rational Emotive Behavior Therapy? It is the most original cognitive behavior therapy. In fact, Albert Ellis conceptualized this way back in 1954. So Aaron Beck conceptualized cognitive therapy for depression after 1 decade, which is 1964. But the best part is Albert Ellis and Beck both were very good friends. They practiced psychoanalysis for 5 years. They both left at the same time because they were frustrated with the results. They realized that both these therapies give you insight, but they do not do anything to do something about the problem. And that's where REBT kicked in, which is action-oriented and active directive therapy, where you change the way you think, feel, and act, and therefore you resolve your problems. Not only that, but we also treat psychological disorders. And that is REBT, a therapy based on a model that states that your psychological distress, your emotional distress, is mediated by irrational beliefs, which means that when events happen, they do not upset us, but it is our irrational beliefs that mediate between the event and your emotional distress. So that's REBT.
Sir. So people, generally it is mentioned that REBT is a directed therapy or it's an aggressive therapy. It's like very, rapid. Because I have seen you online doing the single sessions where I was one of your client in one of the live session and I got benefit out of it. So can we, understand more about what made this REBT as a very aggressive or directed therapy, sir?
I would agree with the first part that it is very active and directive, but it's not aggressive. Aggression is somewhere where, the client would be yelled upon. No, we do not do that. It's not an aggressive therapy for sure, but it's an extremely efficient therapy
Maybe
and
wrong word
active
used.
directive.
Yes.
Sorry?
Is it like very rapid?
I would say it's very efficient, much more rapid than other forms of therapy. I think CBT and REBT, cognitive therapy and REBT, both are equally rapid. In terms of pace, they are equal. However, REBT is slightly more deeper, as I would say that, it targets the irrational beliefs directly. However, both have their own place. Cognitive therapy and REBT both have sufficient research evidence. But in comparison to other therapies, cognitive behavioral therapies, all of them, whether it's DBT, it's ACT, or REBT, they are more active directive, which means that the therapist takes an active role rather than a passive role. Okay, listen, tell me what you are going through. Okay, what do you think you should be doing instead of doing this? No, we don't do this. We simply say, what problems would you like to work on in today's session? And tell me what was going through your mind at that time and how did that make you feel and so on. So, we are more active directive. So a lot of progress is made in a single session. I have seen so many patients who came to me after 5 to 6 therapists and they said, Ki, nobody has done so much work in one session. And it's not me, it's REBT that a lot of work is done in each session. So that's why it's active directive and not aggressive. So we are very kind and gentle and loving towards the patients, but not aggressive for sure. Yes, I mean, like some people did pick it up from the word disputation, that you dispute with the client and you argue with the client. And some REBT therapists who are not properly trained are pretty aggressive. They are pretty rude and ruthless to the patients. They are very curt. And under the name of assertiveness, they are pretty rude and blunt towards the patients. No, this is not REBT. This is wrongly practiced REBT. If you have been feeling uncomfortable with a REBT therapist because of their tone or their aggression, they have not been properly supervised, I would say.
So among the counselors, among the trained people also, after many years of practice, but maybe budding psychologists, there is little confusion between REBT and CBT. They are not very clear. So after so many trainings also, people don't understand and counselor keep asking, what is the difference between RE-CBT? So maybe some more details about it, sir, because counselors are literally, they send these questions to me.
Okay, so how much time do we have? If we have 1 week, I can explain the difference in
I know.
1 week. I can explain the
45
difference.
minutes only, sir.
45 minutes. Okay.
Never, maybe.
All right. Okay.
50 minutes, sir.
So, however, let me tell you, REBT and CBT are 95% similar. And when we say CBT, we are talking about Beck's cognitive therapy. They are 95% similar. There are only slight differences. So technically, REBT is CBT. It's a cognitive behavioral therapy. And under the umbrella of cognitive behavioral therapy, there are various different types of therapy, such as one, REBT, the most original cognitive behavioral therapy. Then comes Beck's cognitive therapy. And then comes DBT, dialectical behavior therapy. Then comes ACT, then MBCT, and behavior therapy, and so on. So there are like tens of different cognitive behavioral therapies. So what is the difference between Beck's therapy and Ellis's REBT is something that I'm going to tell. The kind of cognitions you work on is different in Beck's cognitive therapy and the kind of cognitions you work on in Ellis's REBT. They are different. So I'll give you a very clear example, one simple example. Let's say that you are walking from one point to another. You're walking on the street and you see a friend, right? A very good friend. They are walking from the other direction and you wave at them, right? And when you wave at them, this person does not wave back at you, right? And then you feel very hurt that the person did not wave back at you. So this is an event that the person did not wave back at you, right? Now, this event can be confirmed by a CCTV camera, right? In REBT and CBT, both. This event will go into A section, A, B, and C, as we have the model. A is the event that happened. However, after that, you will have thoughts in your head that this person has deliberately ignored me. You may also have thoughts such as this person does not like me, this person does not love me, they don't want to be associated with me, and this will mean I will end up being alone, right? All kinds of thoughts, anything that happens in your brain, right, that cannot be observed by a CCTV camera is put in the B section in cognitive therapy, which means in cognitive behavior therapy, Beck's cognitive therapy, we consider this is the B. B is the thoughts or the automatic thoughts. However, in REBT, such inferences are also considered to be A, these are activating events. Even if they are in imagination, they are considered to be activating events, right? So REBT will only consider B or beliefs as 4 irrational beliefs that we are going to talk about later. However, REBT considers all possible inferences, anything that can happen or may have happened as an activating event. However, in cognitive therapy, anything that goes into your head is considered to be B, right? So in REBT, the B are only irrational beliefs. Rest is the same. And so REBT works primarily on irrational beliefs. The therapist will work on irrational beliefs, and cognitive behavior therapists will work primarily on the inferences. For example, the reality is different and your version of reality, your inference is different. So they will bridge the gap between what you assumed things to be and the reality is different. So they will work on this. However, REBT would say, even if worst case that happened, let us work on the irrational beliefs underlying them, right? This is a major difference. There are few more nuances. For example, REBT primarily focuses on self-acceptance, like, you are human being, whereas CBT does not have that concept very well deeply ingrained into the philosophy of CBT, that you are a human being. And it's not a philosophical model, it's more of a therapeutic model. And REBT is more of a philosophical model. So it's deeper and it's, I think, widely applicable to different cultures and different religions, and of course, a different variety of disorders as well. So primarily only two differences, rest, do not confuse them. They are very, very similar because, cognitive therapy, Beck's cognitive therapy did originate a lot from REBT. They were friends, they were talking, they were exchanging letters, and they focused on cognitions, which mean changing the way you think. Yeah, they're very similar. So don't confuse.
Right, sir. So when you were talking about irrational beliefs, so if we generally irrational beliefs, we get a big list. If we, as a layperson, if we find we get big list of irrational beliefs on the internet, and according to REBT, there are only 4, as you said. Can you throw light on this, sir? Because
Yes.
therapists or counselors really need this info.
Absolutely. So initially, when Albert Ellis conceptualized the list of irrational beliefs, there were 13 irrational beliefs. And for a person like me who has ADHD, remembering these 13 irrational beliefs is a big task. I would have abandoned REBT if it continued to have 13 irrational beliefs. I would not be able to practice at all. So thankfully, they concretized and summarized the irrational beliefs into only 4. And the original 13 irrational beliefs are combinations of these. For example, the original belief may be, I must be loved or else I am not a good person, right? Or else I'm unlovable. Now, there are 2 irrational beliefs here. One is a must and another is I am unlovable. So today we have only 4 irrational beliefs. One is demandingness. Another is frustration intolerance. Third is awfulizing. And fourth is depreciation. So these are the root belief systems of all emotional upset. So if we can understand any emotional upset, it has to do with either of these irrational beliefs or a combination of these irrational beliefs. So that's as very, very simple to understand. And that's why many times, my students get struggling with, oh my God, which emotion to work on, which problem to work on. They keep bringing different issues. It's like it does not matter what you work on. Whether you work on the core issue, whether you work on a superficial issue, doesn't make much difference because finally you will be working on the same 4 irrational beliefs. So even if they bring up procrastination as a issue, but their, emotional eating is a bigger issue, does not matter what you work on, what problem you work on, you will be finally working on the same irrational belief if these both issues are, in the same person. So I would say that, the proper assessment of which irrational belief you are working on is very important in REBT.
So it comes to 4.
It comes to only 4.
Wow.
Yes, very easy.
So the complete therapy will revolves around this 4.
Absolutely. Absolutely.
But yeah, it looks simple, but it's I know, sir, how tough it is.
I would say tough if tough before practicing. The more you practice, the better you get at it.
Yes.
And I firmly believe in this, that it's not practice that makes you very good at therapy. If you teach REBT to someone else, your skills will rocket like anything. So start teaching REBT to someone else, and you will definitely find you're more skilled than you started off with.
Sir, got it. So now coming to the actual application part of it, after understanding, so for which sort of mental health issues REBT is most suitable, or most used?
So the evidence we have of REBT for efficacy of disorders is almost everything. We see that REBT can be helpful in day-to-day issues such as simple procrastination, or being irritable, or having to control your weight, having to eat healthy food, stopping your reducing your screen time. So, day-to-day issues, hassles, improving relationships, and so on. And then also efficacy is established in disorders such as mood disorders like depression and anxiety disorders, then personality disorders. We have a very good efficacy of REBT in almost everything. Although there is not enough evidence of any cognitive behavior therapy in directly the psychotic disorders, where bipolar disorder or psychotic disorders, they have limitations in terms of efficacy. So we say that REBT is not sufficient for all kinds of psychiatric disorders, but there is some application in every condition. Unless the person is dead, you can use REBT with them, with limitations, of course. So we are not saying that REBT cures everything. It can be helpful in almost all disorders to lesser or greater extent. If not the patient, then their families, caregivers as well. So give it a fair trial of all cognitive behavior therapies. They need a fair trial. Try it for sufficient time by trained therapists. I'm sure that the functionality would improve. Many times we use REBT in conjunction with medication, just like any other cognitive behavior therapy. So we need to understand that lifestyle modification, medication, and cognitive behavior therapies like REBT can drastically improve patient functioning. So do not ignore any of these, right? So sometimes therapists only focus entirely on therapy, but they miss out on biological factors such as vitamin B, vitamin D, B12 deficiencies, D deficiencies are extremely common, thyroid function. So do not ignore biological factors. They have to be treated by a physician. And REBT is efficacious in almost everything.
Right. So there is no, again, the same question, maybe in a different form. Any condition where we need to avoid REBT? In which conditions REBT should be avoided?
I think similar to any cognitive behavior therapy, if the client is extremely aggressive, right, and the client does not have an insight into their problem, REBT is not going to be efficacious. If the client does not want to take emotional responsibility, for example, my emotions, my behavior are within my control, so REBT cannot be used because the client has to be aware of their own thinking and have an emotional responsibility that I am an instrument to change my own emotions and my reactions. So if you see this in any condition, you can go ahead. But if you don't see a willingness to work on the problems, then any therapist will have a tough time.
Yes, sir. Yeah. So they should be ready to change.
Yes.
Then any condition REBT can be applied.
Yes. So they should be ready for change. If they are not, then we can help them get ready for change.
Motivation because of.
But if you consistently see that the client is not aware of their own thinking, does not want to take up emotional responsibility, then REBT and cognitive behavior therapy are not really good models for them.
So any special, I know the confidentiality, but any special case or specific, condition you have in mind upright where, you want to tell us about it.
So
Any
many. Okay, so
one
why
maybe?
why let's not break confidentiality. Why not me, right? So I used to have I think major depression since the age of 7, and it was not diagnosed till the age of 21 when I first went to medical college, being a homeopathic doctor, and that's when our lecturer was teaching depression. It's like, oh my God, this explains my life so well. And that's when I started treatment. And, I did have partial relief with medication. I'm not saying that it's everything. A pill cannot teach you a skill. So I did start on antidepressants. But the massive difference it made was when I went to the institute, Albert Ellis Institute. And, during training, they counseled, the other counselors were counseling me. And my supervisor also jumped in once. And, I had a massive change in my perspective, massive shift in my perspective towards looking at things, and what made me depressed. My perspective made me depressed. And I think that was the moment when I realized that um, accurate understanding of problem and accurate change in perspective can have massive impact on people's feelings. And then I decided that I'm gonna train other people with the same therapy. So this is one definitely, and as I mentioned, I also have ADHD. REBT has helped me a lot in not being so upset about ADHD and using it to my benefit, at the same time still getting more and more disciplined. And I do lose track of time. For example, I had another appointment before this session and I got late and I just didn't have a track of time. So I could have beaten up myself. Oh my God, I'm 15 minutes late. And then everyone is gonna think bad of me, and they will think really I'm a terrible person. But then that would ruin my entire next session as well. So REBT has helped me accept myself as a human being. Not saying that it's okay to be late, but not beat yourself up a little too much. So I would say, having a primary problem, reducing that primary problem, and not getting upset about the primary problem there are two things that REBT has definitely helped me. And
Right.
so is the case with a lot of my clients.
So nice to really listen to the therapy actually helping the therapist by himself.
Absolutely.
So,
Okay, I would like to hear from everyone. Please, in the chat box, where are you watching this from? In the chat box, please mention where are you chatting, where are you watching from? So I'll know that you're watching, and I'll know where are you guys from. Okay, so Geeta, next question. Till then, I'll see the chat box.
yes, sir. So the question for them only. See, many of the psychologists, counselors, or budding psychologists, they wanted to understand how I can become a REBT therapist. So, what is the eligibility criteria? Minimum
Okay.
eligibility criteria. This is the question from many of them.
All right. So, there are lots of training opportunities in India and abroad. We see REBT therapist has been reserved for people who from the Albert Ellis Institute. They have done associate fellowship from the Albert Ellis Institute. However, we do have trainings, sorry, by IAREBT also, which is International Association of REBT as well. So you can get trained. I think the major focus should be on skills training. Where are you getting the training from? Does not matter much, but calling yourself REBT therapist is only reserved to associate fellows of Albert Ellis Institute. But you can call yourself as an REBT trained therapist for sure. So I would say you should get sufficient supervision from a supervisor. And once they approve you of sufficient skills, then you can definitely practice REBT. In fact, even without training, you can practice REBT if you have a a postgraduate degree in REBT, a postgraduate degree in
Psychology.
mental health. It could be psychiatry, it could be psychology. If you have a postgraduate degree, you can practice. But I would recommend that you get properly trained, then only call yourself as a REBT trained therapist.
Trained
Also, we
therapist.
have lots of people from Hyderabad, we have people from Chittor, and age limit, no. I would say anyone who is a postgraduate can definitely go for REBT training. Um, unless you're on the deathbed and you're in ICU, do not sign up for the course. There is no upper age limit.
So,
Okay, all
so
right.
any training centers in India and abroad, sir? Any specific training
Oh, yes,
centers?
yes. So a little bit of history of Indian training centers. When I became the supervisor, there was only one more supervisor in India, but she does not have a training center anymore. And after I became the supervisor, I trained many other trainees, and almost everyone has been my student. So we have training centers in Nagpur, which is Morphic Minds. We offer online and offline trainings as well. And we offer free internships. And very soon we are going to offer an international student exchange program. However, there are training centers in Mumbai. I have a good friend called as Gauri. She is from Mumbai. I have my another student. What's her name? Shraddha Sidhwani, who is from Mumbai. There is another Tanu Choksi. She is from Mumbai. So we have, I think, three training centers in Mumbai and one training center in Nagpur. I think that's it. So we have four training centers in India.
India.
And yeah,
Abroad.
yes. We have another Dr. Sukhada Chimote. She's also my student. So she is in Thane and Pune. So we have like four training centers
So
in
not in
anywhere,
Hyderabad, sir.
everyone is excellent. Please, wherever it's comfortable for you, you can start getting trained. Everyone, I can vouch for my students.
Hyderabad में तो नहीं है, sir.
No, it does not matter. We have internet. We can, students can always attend online training programs. It's as effective. Many times we think that online trainings are not so effective. No, no, no. It's not the case. They're very effective. They're
So
efficient, in fact. Yes.
Yes. So some more information about that internship, sir. You said free. Is
Internships.
it online or offline? Because
Internships are only offline. Just like swimming classes, they are never online. We have internships that are only offline, because what happens is we give practical exposure to these interns. So they get to see the patients, they get to sit through the sessions sometimes. Majority of times the interns are able to sit through the sessions and they observe my therapy sessions going on. And we train them the whole day. I have a very competent team that trains the interns the whole day. From morning to evening, they sit here in the training center. So I have an academic section there. And the internships open every month. For example, the admissions are done on 1st of every month. And the details are always on the website. But now, because I have had demands from two countries, Russia and Malaysia, so they want their interns to be sent to the training center, which, practically it's not possible. So we are going to have some 1 hour trainings for them, not technically internship, but some exposure to our interns, and, the training will be offered to them as well. So I hope to see more international students in the coming few months.
Right. So before we take the questions from them, sir, last two questions. One is for the general public, as this live is on YouTube and the other people may watch other than the counselors and psychotherapists or psychologists. So if a layman's perspective or a general public perspective, what message or what info you would like to send to them? Because some people have a lot of assumptions about therapies and they do not understand. So can we tell something to the general public?
Oh, yeah, there are quite a few things that I would like to tell to general people, but it comes down to two things. One, accept yourself and other people as human beings. You are imperfect and you will always be imperfect, right? You are liable to make mistakes. Other people are liable to make mistakes. So remember, acceptance of yourself as a human being is the root of, I think, a lot of happiness and contentment. You're not perfect. You will never be perfect. However, you can improve on certain characteristics, such as, your academic score can improve, your appearance can improve, your financial status can improve, your social health can improve. These are some attributes, but none of them define you as a person, and your worth cannot be measured. So, remember this: you're a human being, nothing else. No other label attached applies to you. And second, flexibility. It's very important to be flexible. Putting yourself into a lot of pressure that I must be successful, I must be beautiful, I must be liked by people. It's pretty rigid. You would like to be. You would like to be successful. You would like to be liked by people. But it's not a nature's law. The nature has different things in mind. You can drastically increase the probability or decrease the probability of something happening, but it's not an absolute must. I'm not saying it's okay to fail. It's okay to not be liked by people. It is important to be liked by people to be successful, but it's not a nature's law. So be flexible about how you look at things. What kind of goals do you have? And same goes with other people. Like, other people may like you, may want you, but it's not a nature's law. It may happen, may not happen. You can try your best to improve the probability, but you cannot guarantee anything in life. So be flexible and accept yourself as human. Is a very short message that I would like to give to people. Although this is very inadequate, does not address everything, and I agree that, right? How many of you are counselors here? Please write down in the comment box how many of you are counselors or psychologists here. I would love to see how many people are
All of
there.
them, sir. Mostly all of them are students of
Excellent.
psychology only.
Excellent. Mhm.
So again, sir, the last question from my end, and then we'll open this thing for the psychologists or counselors here. So tell us about the Morphic Minds, your activities and services, both, and trainings also.
Okay, so Morphic Minds was established long back. I think I started off with in 1997 as a homeopath. That's when Morphic Minds was established, and then in 2005 I started training. Long back, I think even before that I had started training in psychotherapy. But then I became a certified supervisor later, and we have been running ever since. So Morphic Minds is primarily for training individuals in therapy. I remember how I got into this was I literally used to beg to psychologists who were existing in Nagpur and other cities to let me sit through the session, let me observe a session, I learn myself, because I had done my post graduation and I did not know how to ask a single question to the client. So I was literally very helpless. And none of the psychologists even entertained me. So like, no, you cannot sit through the session. So it's like, okay, so let me just sit in the clinic. I will observe patients and I will observe. Say, no, you cannot do that either. Our patients don't want to be seen. Slowly, I realized that, we mental health professionals are stigmatizing mental health care itself. And then it's like, I'm going to change this from my end as much as possible. When I become a psychologist, I would allow my interns to have free training in my training center. And that's what I do is like I offer free internships. So that's a regular thing. But however, I am not able to give so much time there. So I also have paid trainings where I supervise the interns. So we have REBT training, we have cognitive behavior therapy training. So we offer various trainings that are definitely there on the website. I'm going to write down the name of the website.
Yes, sir.
Um, um, okay, hold on. Okay, I'm going to write it later. So we have lots of trainings online and offline. And upcoming training is in August, which is a mentorship training. In mentorship, I'm going to train CBT and REBT level 1 and level 2. Plus, there would be very intensive supervision. So we usually take a very small batch, 3 to 5 individuals, and we train them individually. But I offer a lot of online trainings as well, like 2-day trainings and 3-day trainings that we offer. I also run an emotional education program, like you mentioned, the core emotional education program in schools, We're going to start the same program in Malaysia and Russia, both these countries. So I think this is what I am doing. However, the students I have trained, they are doing a lot of work. So indirectly, they have reached to different countries. They have started their own practices, and some people are working in corporate sectors. Some people are working in sports sectors. So I think uh, don't just look at my work, but I think REBT and CBT can be used almost everywhere. So I would encourage all of you to, whatever areas you are working in, use cognitive behavior therapy and REBT to enhance, people's functioning there.
Sir, thank you so much, sir, for real inputs and very interesting information. And now I'll unmute all of you. So we can take only few questions as we promised an hour already. Few minutes left with sir. So you're unmuted. Any specific questions about trainings? Any specific question about the therapy? Or yeah, the floor is open. We'll take few questions. Anybody about? Yes, you can raise your hand or you can unmute yourself. Oh, sir, you're on mute.
So we have so many participants here. I would like to see everybody's faces.
Yes, sir. All of them are there, sir. Madhavi is here. Madhavi, hi. Sir, she is one of our, she was my batchmate. Yeah. Can we see all of you? And you're allowed to unmute yourself. Madhavi, would like to listen to you. It's been a long time.
Sir, one question by my side. Actually, I'm joined in the middle for this conversation. I completed my MBA psychology. After that, I'm not sure which course I need to take further to practice psychology. So I have doubted that. Actually, I'm not clear on that part. Currently, I'm working as a software engineer. So in the future, maybe in next coming 1 or 2 years, I want to stop my software job and start some practicing for psychology.
Sir, आप mute में
Your voice is not, you are not alive.
No, sir is on.
Sorry, I'm sorry. So you're already working in a software company. Do you see a lot of people stressed in IT industry already?
Yes.
Their night schedules, working in the US times. Now you have a huge opportunity without exiting that company. Just get trained properly and network with people and start a module in the same company of, reducing stress in IT professionals. So you can definitely use cognitive behavior therapies like REBT. In this industry, you are already there. You don't have to exit it and start something. However, I would suggest that you get properly trained specifically in REBT. A lot of courses are available. You get trained and then you can start practicing where you are. And then slowly, if you want to shift from this current job to REBT, you can always quit the job later. But without quitting, I'm sure that you will be able to network with people and start your work there. Thank you for the question, Chandra. Vishakha, yes, go ahead.
Thank you.
Hi, Dr. Shishir. Actually, I have a question.
Sure.
I'm in Pune now. Hello, Geeta ma'am. How are you?
Good.
It's been a long time. Actually, this is really nice. As you know, I did my REBT training with you guys too. So this was very important for me to attend. However, I did miss little part of the session. My question, sir, is to understand how we can take up sessions actually, because I'm looking to see how we can expand with more experience. And you said there are internship opportunities, but I'm in Pune. And
Okay.
so, yeah, is that something should I be?
So I would suggest that you go for basic training like REBT level 1 and level 2, which I hold frequently online as well. And in September, I'm coming to Mumbai. So maybe you could join the training in Mumbai in September. But you can join the mentorship program, which is a little more intensive but slightly expensive training in August. So if you're super keen and super serious about learning and getting supervised, I would strongly recommend mentorship. However, if you want a basic introductory training to REBT, then I would suggest level 1, level 2 REBT. But mentorship has CBT and REBT both. So these are some trainings that you could do. But you're welcome to do the free internship in Nagpur, starts every month. And then you will get a fair idea of what CBT, REBT looks like. And for the confidence of therapy, I would suggest mentorship.
Okay. Because I've done the training, actually REBT training. So
Excellent.
it's just I haven't been practicing as much on REBT. So like Geeta ma'am said, right? It's like you have to be doing it so often for you to get the confidence of conducting a proper REBT session, just REBT session. So that's what I am kind of looking forward to. So
Yeah.
what I'll do is I'll get in touch with you guys, see how we can proceed with the internship and see if that works.
Absolutely.
And
You're welcome.
so
And
Sir,
I
that's
think,
let's-
what gives you confidence is supervision. But, start without confidence. That's the clue. Don't wait for confidence. It's not a bus that's going to come from, Hinjewadi to Pune, and you board that bus and then you go ahead. No, it's not
that's
a bus.
true.
Confidence will come after you start practicing. So don't wait for confidence, but get supervision and then go ahead.
Sounds good. I look forward to working with you then. Sure. Thank you, Geeta ma'am.
Yeah, thank you so much. And about mentorship, sir, someone messaged me. Is it online or offline?
Mentorship is online and offline.
Oh, both.
Yes. Vijaya, you have a question?
Yes, sir. Sir, good evening, sir. Good evening, ma'am.
Very good evening.
Sir, in the month of May, I have completed my MS in clinical psychology from Apollo University.
Okay.
Now I want to start my career. Right now, I'm 50 years, 49 plus.
Right now?
I'm for 50 years, sir. 50th year running. So,
That's a
with
good
the
thing.
inspiration, yes, sir. With the inspiration of Geeta ma'am, I have joined regular course in MSc clinical psychology, Apollo
Excellent.
University. So,
Mhm.
I have
So you have
completed.
finished or you are still doing the MSc psychology?
Completed, sir.
Completed. Excellent.
Yes.
Okay. A lot of us, finish their life responsibilities and then turn to the passion, which is psychology. And you're not just the only one. I would strongly recommend, again, proper training in any of these therapies, REBT specifically. Get properly trained and you can start practice, right? So supervision is super important. If you may find a lot of courses on Udemy also. Even I have a course on Udemy, but you will see that supervision gives you so much of skills and hands-on experience that this is now I know what to do, what not to do. It gives you a therapy, a structure. You know what to do when you're stuck. But I would recommend everyone to buy one book, which is Practitioner's Guide to REBT. It's a Practitioner's Guide to REBT, 3rd edition. And once you read that book, then you start training. So I may write it down here, Practitioner's Guide to REBT, 3rd edition. So this is a nice book where you get a lot of insight of REBT and understanding of REBT, but then nothing can replace good supervision. Yes. I hope that answers your question. Please start your therapy practice. Don't wait for confidence. Get some training and get started.
Surely, sir. Thank you, sir.
All the best. Yes. Somebody
Madhavi?
had
Yeah,
Yeah.
Madhavi, go ahead.
Madhavi.
Good evening, Dr. Geeta and Dr. Shishir. I am Madhavi Anand. Thank you for telling us that it's not about, thinking, looking straight, but you have to think straight. So thank you so much. And I really, I feel that REBT is such a subject that it is, how much ever we learn, it's not enough. We have to keep learning again and again and again. And for me, whenever Dr. Geeta, she posts some kind of an interview, I just jump in because I have so much of trust in her. I am basically from Srikakulam, Visakhapatnam. So somebody who was telling, can I have an internship I and Geeta, you know how many hours and hours we have spent. It was like an exam we had for a week of REBT sessions with Gauri.
Wow.
And we were basically, I feel REBT more than for anybody else, it is for our own self. And
Absolutely.
I have improved myself more. And then once I feel that, okay, where am I going wrong? Which is my irrational belief. Trust me, even though I know I will be having some kind of judgmental, irrational beliefs. So I would definitely come as an intern and join you, sir. To tell you more about myself, I have a clinic at Srikakulam, Andhra Pradesh. Basically, I work with children more, adolescent and educational, but I also deal with clients from US for our REBT sessions and psychology sessions. I'm an educational psychologist, NILD educational therapist, neurocognitive therapist, CBT. I haven't done CBT, but I'm a psychologist. So I would like to learn more about it and join more of your sessions. So that is what as somebody who wants, please join these sessions. I would recommend when Dr. Geeta and Dr. Shishir are holding. It is more important for others than, it's more important for you to have a better thing. Somebody said, I am 50 years old. So that itself is an IB. So that's a belief that being 50 years old, I can't start anything. So please go and join. Thank you, sir.
Thank you, Madhavi, for the kind words. All
Most
right.
welcome.
Sir, so thank you so much, all of you, for your real interactive questions. And also, it means a lot for us. And also, thank you so much, sir. Thank you for
All right. So
spending
I
your
just
valuable
wanted to
time.
tell everyone,
Yes.
join the mailing list on the website, morphicminds.com. I have already put somewhere in the comments. If you join the mailing list, you will get updates about all our training programs. And you can follow me on Instagram, Facebook, everywhere, so that you get more and more REBT content. I post a lot of REBT content in terms of reels. And I would be happy to connect with you. Follow me on Instagram. I'll be happy to connect.
So
All right.
one
Thank you
last
so
question.
much, Geeta. Yes.
So Dr. Shishir, I just wanted to know if we have to recommend any client to you. Do you take online sessions?
Yes, I do. Yeah.
Set.
Online sessions,
Okay.
definitely. Yes, I do.
So appointment or anything, is it through Morphic Minds or through?
Yeah, everything is on Morphic Minds. They can directly book sessions online, pay there, and
With
then
you.
get the booking. Everything
Okay,
is there on the
fine.
website.
All right.
Right.
Okay.
Thank
Okay,
you.
so thank you so much. And today, the two beautiful words which I got and everybody should hold on to: accept yourself and also be flexible in life. So thank you so much, sir. We
Thank
really
you,
love
Geeta,
to
for
see
this
you
lovely
again.
opportunity. I have to come to Hyderabad again. Oh my God, like you rekindled the memories of St. Xavier's. Which college was that?
St.
Like not
Francis, sir.
St.
St.
Francis.
Francis.
No, not St.
St.
Xavier's.
Francis.
St. Francis. My God, that was ages back.
Yes, sir. But still, I remember the session
Oh
you
my
gave
God.
me that
Yeah.
day, and the belief which I had about myself that was broken.
Lovely.
And till today, I remember that.
Oh, lovely.
That's the
I'm
therapy
forever
effect.
grateful to you for all the appreciation. Thank you so much, everyone. Bye-bye. Take care and
Thank you,
enjoy
sir.
your Saturday evenings.
Thank you so much, sir. Thank you all. We'll end the call here. Namaskar, sir.